Well, hello, it's Bruce Williams again, and today I want to present part 2 of my series on the selected gross pathology of the respiratory system. Part 2 is going to cover viral diseases. As a matter of fact, I've split the viral diseases into 2 lectures, so parts 2 and 3 will be viral diseases. We'll cover the DNA viruses in part 2 and the RNA viruses in part 3. Now, it's not too important from a gross pathology point of view, but DNA and RNA viruses are different in that with the DNA viruses, their genetic material is composed of a double-stranded or a single-stranded piece of DNA, and they use a DNA-dependent DNA polymerase, which you find in the nucleus of cells, to replicate this material. That's nice because it means that if you're looking for inclusions, for viral inclusions in these diseases under the microscope, the DNA viruses will generally have them in the nucleus of the cell. And the RNA viruses, because they use RNA transcriptase to replicate their genetic material, usually will form their viral particles within various organelles of the cytoplasm, such as the smooth endoplasmic reticulum or certain types of vesicles. But we'll leave that for now. We don't need to know any more about that. As I do at the beginning of all of my lectures, I want to thank my friends and colleagues who provided me these great images over the years, which allow me to put these lectures together. And you will see with each passing lecture, this list gets longer. Another outstanding reference that I want to point you to in addition to these lectures, which will give you a lot more information about the viruses themselves and their pathogenesis, is one that Dr. Fabio Del Piero provided for the Foundation. And you can see this on the Foundation's YouTube channel at the initial onset of the coronavirus outbreak this year. It's a great 1.5-hour lecture. There's about 30 minutes of questions at the end, and I think that you will enjoy very much. And it may fill in some of the holes that are in this particular lecture because we focus primarily on gross pathology. Another concept that has gained importance over the years, especially my career, is the concept that many animals today, because they are brought together, whether it's a shelter situation for small animals or it's a feedlot situation or any way time that you get naive animals together, there is a predilection for various animals to bring different viruses and bacterial diseases to that group. And so today it is very uncommon to see animals that are only infected by one virus. We talk now about respiratory disease complexes. The bovine respiratory disease complex, for example, has several different viruses, which we'll talk about in the next lecture, and then a range of bacterial agents that come in once the virus has knocked down the immune system. It wasn't for those viruses, some of which are fairly innocuous. Those pretty severe bacterial infections wouldn't have the opportunity to grab hold. You see a similar thing in swine, porcine respiratory disease complex. If you autopsy a lot of swine, not the ones from the really good producers, but the ones from sort of the marginal producers, I won't say backyard swine, but small herds, and you have respiratory disease, you'll find that you're able to identify quite a number of viruses and several bacterium within these animals. So the concept today of being able to isolate one causative agent in many respiratory infections is fairly uncommon. A lot of the pictures I show you may be experimental infections in which one organism was inoculated into a naive animal and you get the full-blown disease. We're going to talk about the full-blown disease, a lot of these viruses and bacteria. Just realize that usually what you see today is a grouping and lesions associated with a number of infectious agents at a time. The first group of DNA viruses that I want to talk about, one that affects so many different species in so many different organ systems, are the herpes viruses. There are three basic types of herpes viruses that you should be familiar with. The alpha herpes viruses are the ones that cause the most respiratory disease. These are the viruses whose nominative lesion is necrosis. They cause necrosis, ulceration of mucous membranes, etc. Sometimes, especially in young animals, they will get loose in the body and you'll see necrosis in multiple organs. The second type of herpes virus that we'll talk about are the beta herpes viruses. These are fairly uncommon, but the prototype virus is cytomegalovirus. We all carry cytomegalovirus. Every animal species carries cytomegalovirus. Only a few are a pathogenic problem. Usually you don't see them after infancy. But there are at least one disease we'll look at in which young animals will develop respiratory symptoms from cytomegaloviruses. These are the viruses that often pop up when the animal's severely immunosuppressed. You may see them in the lung in an immunosuppressed animal like a rhesus macaque with SIV, but they don't represent a large number of cases. And then finally, the third type of herpes virus are the adenoviruses or the lymphocryptoviruses. These used to be called the gamma herpes viruses, but they've been split out now. And their main function is to result in the liberation or the causation of lymphoproliferative neoplasms. So those are three basic groups. Alpha herpes viruses, the ones that cause most of the classic diseases. What we're looking at here is a cross-section through the nasal turbinate of a cat. And cats, especially in shelter situations, are well known to develop a respiratory disease complex, which may be one of a number of viruses. The two that are most commonly seen are the herpes virus, which causes viral rhinotracheitis, and calicivirus, which is a RNA virus we're not going to talk about in this lecture. But when you combine herpes viruses and caliciviruses in shelter situation, that's probably going to be about 85 or 90% of the viral upper respiratory infections. Now, usually these are associated with a secondary bacterial complication, which could be one of a number of bacteria that the animal carries as normal flora, like Pasteurella multocida or Bordetella bronchoseptica. It could also be some of the lesser known ones like Mycoplasma of a number of species, including Felis, Gatti, Argenini. Could also be one of the chlamydia, which is a common inhabitant of the upper respiratory system of cats, or strep canis. Unusual that you would see anything named canis in a cat, but it's a well-known cause of chronic sinusitis. To get back to these herpes virus, okay, herpes viruses, as a general rule, really like lower than normal temperatures. That's why we see them infecting young animals, especially who can't maintain their body temperature yet, and they often will cause infections around the face and the nose where the temperature isn't quite the same as core temperature. We will see, even in the cat, that the herpes viruses can operate very well and be devastating at core body temperature. Remember that herpes viruses are viruses that go latent. This particular herpes virus is very happy to undergo latency in a number of structures of the head and the neck, including the trigeminal ganglion, the optic nerve, olfactory bulbs, and the cornea. And so these animals may show no clinical signs, and then when they are stressed, they will develop a runny nose or lesions on the face or the eye because the virus comes back after stress. And in between outbreaks, you really have no way to diagnose this particular animal as having a herpes viral infection. This is a complicated herpes viral infection because look at all the mucoid material and the snottiness of this nose. In animals with these chronic infections, they're absolutely miserable. It can also go so far as to see lysis of the nasal bones. You can have damage to the olfactory epithelium known as anosmia. And this could progress all the way down from initially a sinus infection to a secondary bacterial infection, as the animals will be inhaling this particular material. So feline viral rhinotracheitis. The herpes viruses have a lot of names that are associated with rhinotracheitis. And we'll look at those in a minute. As I always start these lectures up at the top, and I try to at the top, let's look at another herpes virus that can cause lesions within the sinuses. Another classic herpes viral infection of the upper respiratory system, and one that's called rhinotracheitis, is the alpha herpes virus that causes infectious bovine rhinotracheitis. What we're looking at here is very inflamed sinuses, and then you can see a membrane of necrotic material, whether you call it a fibrinonecrotic membrane or a diphtheritic membrane, whether you want to call this a diffuse fibrinonecrotic sinusitis and pharyngitis, that'd be absolutely fine for this. And this is an alpha herpes virus that you often see in young animals, especially within 3 weeks of getting to the feedlot. This, although the name is rhinotracheitis, really preferentially causes severe lesions in the nasal cavity. And I think a lot of people, when they hear the term tracheitis, they think it's a tracheal disease, but I think you're going to find your best lesions in the nasal cavity. So don't sleep on that. In these animals, you can see that the nasal mucosa is a bright red. The nose will be ulcerated and be a bright red, and for many years this was called red nose. These fibrin plaques that you see are common because it's a herpes virus of the face. You may see problems with the eyes, including keratoconjunctivitis. And this particular virus can be shed in the secretions for 10 to 16 days. There are other viruses that will cause similar lesions, like parainfluenza virus, RNA virus, but they're never as severe as the ones that we see in IBR. Remember, IBR, in some cases, it is not too picky in terms of the epithelium it goes after. So you can see lesions and ulcerations. Herpes viruses cause necrosis. Necrosis of a mucosal membrane will cause that membrane to slough. And it's not just in the sinuses and the trachea, as we see here, but you can also occasionally see it in the mouth, where it will mimic some of the other important diseases of cattle, like mucosal disease. And these areas of ulceration can actually even go down into the forestomachs, the first 3 of the forestomachs, because they're lined by stratified squamous epithelium. So rumen, reticulum, and omasum may have lesions associated with IBR, but generally it's a fairly mild infection. The pictures that I show are always really severe. They're textbook pictures, but a lot of the cases they don't look like this. But here's a very red trachea with some fibrinonecrotic material. I would always think first of IBR in a case like this. There are some other diseases I'll probably show you later. You can get a bad case of Pseudorabies that can look somewhat like this. But if you go with the alpha herpes virus that causes, which is bovine herpes virus 1, a little hint, if it's herpes virus 1, it's probably going to cause the respiratory system. ILT in chickens, avian herpes virus type 1. So this particular virus can also cause lesions around the prepuce and around the vulva of cattle as well. Remember, just like squamous, stratified squamous mucosa or respiratory epithelium. So it can do that as well, but those conditions are a very small part of the overall picture. Okay, so as we said before, this may not be a severe problem, but it is enough to allow secondary bacterial invaders to get a foothold in the respiratory tract and result in some of the bad bacterial pneumonias that we're going to look at in upcoming lectures. This is also a great picture. There is a subset of these cases of IBR, which rather than having plaques, have sort of an exudate. If you get a lot of neutrophils within the lumen and some necrotic debris, and they all party and they blow up, you're going to get some exudate. So if you see something like this, don't rule out IBR, because it's not always bright red and fibrinonecrotic. Sometimes you get these sort of ooey gooey cases as well. We mentioned infectious laryngotracheitis in chickens, especially. Once again, it's an alpha herpes virus. It is avian herpes virus type 1. Avian herpes virus type 2, we may even look at in this lecture, is the causative agent of Marek's disease. It's one of those gamma herpes viruses. But type 1 is always infectious laryngotracheitis. This is primarily a disease of chickens, but you can see it in other types of poultry as well. You can see it in guinea fowl and some wild poultry type animals. Now, this is a particularly severe case. If you want to see another particularly severe case, here are a couple of goodies. Okay, now, just like with IBR, most of the cases of infectious laryngotracheitis that you see are not going to be this bad. There are several types of infectious laryngotracheitis. Many of the cases that we see, at least in this country, and a number of other countries as well, are going to be very mild cases, and they're derived from the vaccines that the animals get. Generally, the really well-kept flocks have vaccinations at certain times, and they're all in and all out. So you don't sort of get this chronic low-level ILT. But in flocks that are not managed very well, or backyard flocks where you have a lot of animals that kept around for a long time, you will see this disease on a fairly low level but recurrent. The animals have been vaccinated, but then because you're constantly bringing in some new ones, you have some cases, and most of the cases you won't see a lot of exudate. You'll see the animals snicking or slinging a little bit of mucus or gagging. And what these flocks, a lot of these flocks say, oh, we got ILT again, and we vaccinate a second time. We vaccinate a third time without thinking that the vaccines have to be given at particular points in developing the disease. So they never really eradicate it, and then some of these vaccines will revert to causing a very mild type disease. So when we show you these pictures of these severely hemorrhagic or these extensive diphtheritic plaques, just realize that is the terrible end of the spectrum. But if I see something in a chicken where there's this much blood within the lumen and severe congestion and ulceration of the trachea, I'm going to think about infectious laryngotracheitis. When you get down to the ones with fibrinonecrotic membrane, there are other diseases that will cause that, including pox, which we are going to talk about. And so you got a differential. For me, something that looks like this, there aren't a lot of differentials. This animal, when it snicks, it'll be slinging blood out of its head. But this is the really bad end and not representative of what we see in this disease in a whole. Well, pigs are not spared either. Okay, this is a disease of young pigs. This pig's probably less than 3 weeks of age, and it is also an alpha herpes virus. This is Pseudorabies. Pseudorabies, the causative agent of Pseudorabies and Maddich and Odjeski's disease, is a very classic alpha herpes virus which likes to cause necrosis not only in the sinuses but in a range of the tissues of pigs. It goes systemically in these very young pigs, so you'll see necrosis in a number of organs in the very young that are affected. As animals get older, the symptoms aren't as bad, but if you can see necrosis in the respiratory system, you can see necrosis in the tonsils and the liver, they will develop neurologic signs. So this is more of a systemic condition, but it is a herpes virus, and a lesion, if you see it in the sinuses, is much like what you see with IBR in cattle. Now, a lot of these different herpes viruses, we talked before, they really like the sinuses, the more external or peripheral parts of the body because the temperatures are lower. But do not forget that they can cause, some of them will cause a very severe pneumonia, especially in younger or immunosuppressed animal. These are the lungs from one of those young pigs with Pseudorabies. These animals were probably inoculated, but all of these areas of hemorrhage are really areas of necrosis. In certain species, herpes viruses really like to cause necrosis, and because they like epithelial cells, most of the necrosis that you will see will be in the airways and lining the airways. A classic example is that feline herpes virus type 1 that I showed you before. It can cause simply a upper respiratory infection, or it can be absolutely devastating within the airways of the lower respiratory system, the bronchi and the smaller airways of the lung proper. There are two actual lesions here. One of these areas of necrosis and hemorrhage. Remember, oftentimes when you're looking at hemorrhage, you're really looking at necrosis, but because necrosis is sort of a bland grayish color, it's often covered up by the bright red of hemorrhage. And it looks a lot like what we saw in this previous one, where we have these areas of hemorrhage here. The other thing that happens when you have necrosis of the airway epithelium and sloughing and exudate of inflammatory cells into those ulcerated airways is you have extensive areas of atelectasis. We'll see this in some other slides of viruses that attack the epithelium. And so essentially you get all of this exudate, and it blocks air passage through those airways. And so all of the alveolar tissue that is fed by those airways runs out of air, and it collapses on itself. So we've got a couple of things going on here. The fact that most of this is in the front, I'm also concerned about a bronchopneumonia, a secondary bacterial bronchopneumonia, which could be, as we said before, the result of something like Pasteurella or Bordetella on top of everything. Now, one of the alpha herpes viruses, one of the last really important ones of horses, is one that in adult horses may cause some sinusitis, a mild snotty nose, usually pretty mild signs. As mild as these signs are, they get everybody very excited when a mild upper respiratory disease goes through your barn, because it may be the first sign of equine herpes virus 1 type infection or equine rhinopneumonitis, which is a big problem in several parts of the country, including where I live in the mid-Atlantic states, where we get notifications several times a year that there's herpes virus going from horse to horse. It will shut down the racing. It shuts down even animals transferring pleasure barns. So it's a big thing in this part of the country. Oops. This disease itself, as we said, doesn't cause much in adult immunocompetent animals. The biggest problem that it causes is that animals that are pregnant will have it will cross the placenta, it will infect the developing fetus and result in fetal abortion or stillbirth or the birth of very weak foals. It particularly, and one of the most characteristic lesions, is a sort of two different lesions that you will see in the lung, or even three. But one of the lesions that you will see that's demonstrated very nicely here are those little white areas scattered through all the lung lobes, which are areas of necrosis, just like we saw in the pig lung and the cat's lung, except we don't have the decoloration by hemorrhage. This lung also looks fairly large because there is tremendous amounts of edema. Just like we see in the cat, this virus will attack the airway epithelium. Airway epithelium will become necrotic, it'll slough off. And if I haven't mentioned it before, and I don't think I have, when you are looking for the microscopic lesions of herpes virus, whether it is IBR, whether it is infectious laryngotracheitis, whether it is in a cat, whether it's in a horse, you want to look in the airway epithelium first. And it's not going to be very difficult when we look at these slides. Tremendous necrosis, and there'll be exudation. And you want to look at the interface of the normal tissue and the necrotic tissue. And right in that area is where you're going to see very classic lesions of those intranuclear inclusions, because all those viruses are being made in the nucleus. Eventually, they're going to reach critical mass. The nuclear membrane will dissolve, and the cell essentially will explode, liberating all of those viruses to infect other cells. So we're going to look for intranuclear inclusions, and we're also going to look not only in the lining epithelium, but very importantly, especially in something like ILT, you want to look at the sloughed necrotic epithelium, because you'll often find it there. Another very characteristic finding are viral syncytia, because these viruses cause cells to merge. And so you will see multinucleated cells and cells with viral inclusions, and sometimes you'll even see multinucleated cells with viral inclusions in the nuclei. But a lot of times you have to abandon looking through the denuded mucosa of the airways and start looking within the luminal exudate to find those. So back to equine herpes virus type 1. In infected foals, if you see these lines, these are rib impressions. And the rib impressions suggest that the organ is larger than normal. Normally the lungs will sit nicely without pressing up against the ribs, and so you get these rib impressions here, which means that this lung is filled with something. In the case of equine herpes virus, it's almost always fluid. This lung looks pretty good, except we have those rib impressions here, but you see this tremendous pleural effusion here, and this lung is full of pulmonary edema because you have damage to the type 1 pneumocytes as well, and you can have an exudation of fluid into the alveoli. It's not just edema fluid when you have damage to the type 1 pneumocytes. People always think it's got to be the vessels. It's got to be the vessels. And we're going to look at some viruses later on in the next lecture that hit vessels. But this one very happily just does airway epithelium and pneumocytes. But if you take out those cells that line the pneumocytes, the alveoli will quickly fill with edema fluid in which there is fibrin, and that fibrin will polymerize. So when you look at these lungs, you see a lot of polymerized fibrin, you see a lot of edema fluid. Sometimes what you can see in these foals, it's a great lesion, are fibrin casts. And very classic, here is the trachea here, the head of the animal is on this side, here is the carina, right here, and you can see this beautiful fibrin cast which is formed in the trachea. Trachea is very congested. The equine herpes virus type 1 doesn't really care very much. It's not like bovine herpes virus type 1. It doesn't really care that much about the upper airways. But but these fibrin casts are very nice to find in cases of equine herpes virus. There are a couple of other viruses in horses I probably should mention that can cause in the foal respiratory infections, including equine cytomegalovirus, which is gamma herpes virus in young animals, equine adenovirus. We're going to talk about equine arterivirus, which generally in adults doesn't cause much of a lesion, but causes a rapidly progressive bronchopneumonia in foals. So there's a couple of other ones to think about as we continue our discussion of the herpes viruses. Okay, so those are really big alpha herpes viruses. Every species has alpha herpes viruses. If you look at any little lizard or any mammal, you will find multiple herpes viruses. We probably have 20 or 30 in people as well. They're very common. Alpha herpes viruses tend to be the most common one. And as we said before, they often are latent, and then you see them in times of stress. For example, in people, you see people who are stressed out might develop cold sores, but when they're normal and happy and not quarantined, everything is fine. And that's the nature of these herpes viruses. Okay, we're looking at a cross-section from the snout of a pig, and someone's probably looking for atrophic rhinitis in these animals because we're going to talk about atrophic rhinitis as well when we get to the bacterial infections, but they took a nice sample cross-section at the first premolar, and that's where you want to do it so you get some really nice pictures of these scrolls. And we're not seeing a lot of atrophy here, but what we see on the one side here is some hyperemia and a lot of mucoid exudate. This is a condition that is known as inclusion body rhinitis, and it's caused by a cytomegalovirus in pigs generally between 3 to 6 weeks of age. In the vast majority of cases, it causes a sort of uncomplicated seromucus rhinitis, and the animals will sneeze and cough a bit, but the vast majority of them will recover. In a couple of animals, you may see a generalized syndrome where they will develop hemorrhages throughout the body and hydropericardium, but most of it are uncomplicated, and you get this. As we talked about cytomegaloviruses before, this is unusual because it's transmissible within a herd. Most of the cytomegaloviruses we are given during development. You're born with them, and only if you are severely immunodepressed will you develop disease, and often severe disease. There aren't a lot of times that we ever see cytomegalovirus except in very immunosuppressed animals, especially non-human primates. You may see them routinely, not routinely, but every once in a while in guinea pigs, where they will turn up in salivary epithelium or in the lung. If I think of a species, that's the one that always comes to mind. And then you have this particular disease, which is infectious. It is transmissible. It doesn't cause a whole lot of problems, but it's unique in the cytomegaloviruses. Now, I mentioned there is another type of herpes viruses, which used to be called the gamma herpes viruses. They've been split into adenoviruses and the lymphocryptoviruses. The gamma herpes viruses are usually cause lymphoproliferative diseases in a number of animal species, including humans with Epstein-Barr, including baboons and rabbits. But occasionally they will cause other syndromes. And associated with immunosuppressive diseases, they cause tremendous fibrosis of the mesentery in non-human primates. In horses, one of the things that is caused by the gamma herpes virus, equine herpes virus 5, is a very unique syndrome that has been around for quite a long time, but not until Dr. Kurt Williams of Michigan State identified the agent did we know that the causative agent of equine multifocal or multinodular pulmonary fibrosis is a herpes virus, a gamma herpes virus, equine herpes virus type 5, and there's a very similar one that affects donkeys called asinine herpes virus type 1. I love this picture. What you see here are multifocal coalescing areas. When you cut into them, they're just fibrotic. And I remember years ago someone said, are you seeing these fibrotic lesions in horses? And everyone's saying, yeah, we are, but we don't know what it is. No one knew what it was. But they're just these coalescing areas of fibrosis. I love this picture because you can see the vascularity, the neovascular formation that is serving these areas of inflammation and fibrosis. On cut section, of course, the lung is hard to cut. You have these areas of fibrosis, and in and around them, in these little cracks and crevices, and around the side, you will see alveoli that are filled with macrophages and cellular debris. And everyone thought, well, okay, there's macrophages, and they are reacting to the fibrosis and the cytokines, until Dr. Williams, looking at lots of slides, picked up what none of us had seen, and those are large intranuclear inclusions within the macrophages of all things. And turns out that those are gamma herpes virus, which drives this fibrotic process. There's a lot of these in the last 10 years of the Wednesday slide conference. If you're interested in looking, it's always a challenge that when you put the slide on, it's easy to tell that you're dealing with a case of multinodular pulmonary fibrosis because it's just a lot of fibrous connective tissue. The tough part is having the patients to scan around and find those inclusions in the macrophages. They look like tumors. All the lung lobes are infected. There's a lot of inflammation, and but now we know what the cause is. Okay, so we've covered the herpes viruses of note, but there will always be more herpes viruses. There'll probably always be more respiratory disease associated with herpes viruses, but I think we've covered the really important ones. Let's move on to another category of viruses very important in man and a number of other species, and these are the adenoviruses. Okay, now adenoviruses are viruses that are probably pretty widespread in animal species and natures. Some cause significant disease in a wide variety of organs. They can affect the blood vessels. They can affect the intestine. They can affect the lungs. One of the classic diseases associated with adenovirus infection in the lung of domestic species is seen in the horse. Equine adenovirus is fairly widespread in horses, but usually doesn't cause much of any problem. Remember, as we talk about adenoviruses, that they often like to affect epithelium. They are DNA viruses, so you will find very large inclusions, larger than herpes virus inclusions, although today you often want to do specialized testing because I've seen a lot of cases where you can't tell. It's really big. It could be herpes virus, it could be adenovirus. So it's a widespread thing in horses, and it really doesn't cause a whole lot of problems, with the exception of severe combined immunodeficient animals, particularly Arabian foals. And this had been a problem in Arabian foals because they were not able to rearrange the T cell receptors and generate functional T and B cells. So because of this genetic abnormality, they were severely immunodeficient. These poor animals would be infected at birth by a number of agents. Pneumocystis carinii is one that we'll talk about later on, that you're pretty much born with, and if you do not have cell-mediated immunity, it will eventually cause diffuse granulomatous pneumonia. Because of the widespread nature of adenovirus This is a very common infection in these severely immunosuppressed foals. They would be infected very early on, within the first couple of days, with this innocuous virus, and it would just cause tremendous problems with necrosis of airway epithelium. And what we're looking at here are a couple of still inflated areas here, some overinflated areas with a bullous forming here, and all of this red sort of patchwork quilt look are those blocked alveoli, because the airway epithelium is necrotic and there's a big plug of detritus and cellular debris. In the adult animal, no big deal. As my good friend Don Muton would say, no great shakes. But in these young immunosuppressed animals, it was a killer. Unfortunately, these animals don't live more than probably 1 to 2 weeks, even with really good care, because of the tremendous number of infectious agents that just invade. And the lung is only one of a number of organs that have tremendous problems. Here's another wonderful picture showing a very similar checkerboard pattern in a young baboon. It's a great picture by Dr. Ed Dick. And they have had a number of outbreaks of this particular adenovirus, which generally affects juvenile baboons less than 8 weeks of age, because their immune systems aren't really formed. Adenovirus has been documented in a wide range of monkeys and apes. It only shows up in the very young, or if the animals are infected with simian lentivirus or SIV and immunosuppressed. SIV is, we're not going to talk about in this particular lecture. It shows up in a lot of other lectures, but it is a virus of African monkeys that generally have no problem with it, but when it's spread to Asian macaques, like rhesus or cynomolgus monkeys, causes tremendous immunosuppression and is a prototype virus, very much like human immunodeficiency virus. So that's where we're going to see adenovirus in non-human primates, in the very young or in the immunosuppressed. In this outbreak, it was an 85% mortality. So it can show you that in the right host, how devastating these adenoviruses can be. Another species is a great picture by Mitchell Troutman that is affected by adenovirus, and once again we have this checkerboard pattern. It reminds me of the old-time red and white checkered tablecloths you would see in Italian restaurants that Billy Joel would sing about. But these are areas of atelectasis. Here's a large area of atelectasis here in a guinea pig. And this is a disease that, once again, it's widespread, doesn't affect many animals, and it's almost always associated with some sort of surgical or medical manipulation of these animals, and then 1 or 2 of them will break a couple of days later with this adenovirus. These are the cranioventral lobes, which are severely affected. It could be the adenovirus, could be a secondary bacterial infection like Bordetella following the adenovirus at all. So it's in this particular species, low morbidity, high mortality, and it's unusual in that older animals are usually affected. When we look at most of our diseases, it's usually young animals, especially guinea pigs. Guinea pigs, it's the young or it's the pregnant sow that gets almost all the diseases. This is one of the few spontaneous diseases of adult animals. And just to be a little bit more complete, I am going to mention another adenovirus. Now, if you look at this, we don't really have the checkerboard pattern. What we have is a lot of fluid that is separating all of the lobules. And remember, there are a number of adenoviruses, including those that affect deer, those that affect cattle, which tend to affect the endothelium. And so you will see a lot of edema, especially in the lungs or in the gut, or hemorrhages in the gut, because these are vasculotropic adenoviruses. And the ones that cause The adenoviruses that cause disease in deer tend to go toward the endothelial. There's one that causes high mortality in mule deer. There's one that causes mortality in white-tailed deer, fawns. We're going to talk when we get to the RNA viruses about other viruses that attack the endothelium of the respiratory tree, including the orbiviruses. And that would be a pretty good rule out. If you saw a deer and you had this tremendous amount of edema, separation of globules, I would think probably first about orbiviruses, because epizootic hemorrhagic disease of deer can be a misnomer, and you can have a lot of edema instead of hemorrhage. But don't sleep on the adenoviruses in wild cervids as well. Okay, so we actually have one more group of DNA viruses that attack the respiratory system. I will give a shout out to the other DNA viruses that aren't really represented here, but they do cause some pretty significant diseases. Ones that we are not going to talk about are the polyomaviruses. Those are pretty good, cause beautiful sort of smudgy intranuclear inclusions, and you can see that in fledgling cetacine birds. You can see them really nicely there. You can see them in the epithelium of dog skin. Polyomavirus causes some really nice coilocytes. So they affect epithelium as well. They just don't really do much in the lungs. So the polyomaviruses, the papillomaviruses, and then the iridoviruses. We don't see them very much. It's more of a lower vertebrate problem. Fish get cutaneous iridoviriasis, which cause proliferation of fibroblasts and fleshy tumor-like looking things. And they are diseases of insects as well, which I don't do much of. And then finally, the ASFAR virus, the cause of Asian African swine fever, used to be an iridovirus when I started my training a long time ago, and they split it out for reasons unknown, and that also is not something that we will discuss in the respiratory system. So with that, we have one more virus that we probably need to talk about. It's a virus that is well associated with infection of epithelium and sometimes will affect the epithelium of the respiratory tract, and those are the poxvirus. What a fantastic picture by Dr. Lyndon Craig of the University of Tennessee. And you can see these large proliferative lesions on the oral mucosa underneath the tongue. This animal probably had some lesions on the skin. Poxviral lesions are somewhat unusual. The virus particles initially are produced in the nucleus because they are DNA viruses. But in most cases of pox, they have these tremendous inclusions in the cytoplasm. These are viral proteins, and eventually, because of the size, this is one of the largest of the viruses. Because of the size, you end up with a combination of this large inclusion of viral protein and viral particles within the cytoplasm as well. So we think of the inclusions as being cytoplasmic, but the viral production truly starts in the nucleus. Okay, so it really likes epithelium. In birds like this one, it likes non-feathered epithelium because they're usually spread by biting insects. And pox is a pox is a pox. I've always said that, and it's one of those lesions that if you've seen one, you've seen them all. Usually, with most pox, they are crusty lesions with a proliferative ring with a center of necrosis, and that sort of tells you a little bit about the pathogenesis. Poxviruses have evolved so when they infect the epithelium, especially cells of stratum spinosum, they cause a tremendous proliferation because that's more cells for them to infect. So you get this tremendous sort of warty growth-like lesion, and then that begins to grow, and over time, The oldest infected cells, which are now in the middle, succumb to the cytopathic effect. Too many inclusions, the cell ruptures, spreads more virus particles to the surrounding cells, so they always look like a raised lesion with a necrotic center. I call them all ulcerative and proliferative dermatitis. Let's say dermatitis, okay, because they always look alike, so I never have to think about what the morphologic diagnosis is going to be. Now, you have a couple of different types in poultry. You have the dry form, which I've just described, and you usually see them on the skin of the face, the feet, the wattle, the comb, whatever. You also have those that predominantly affect the mucosa of the oral cavity, and also can affect the laryngeal mucosa, to a certain extent the tracheal mucosa. It's not really the larynx, it's the syrinx, and they will get in here, and this is called wet pox. They're more proliferative, sort of gooey. They don't have the necrosis. I'm going to tell you a little secret. For years, I thought that this was wet pox, and then Rob Porter, who's given me a bunch of great slides over the years, said, no, that's actually ILT. But it looks like a great picture of what wet pox would do. And you can imagine these animals are going to asphyxiate because they get these proliferative lesions down in the mucosa of the syrinx and in the trachea. And so it's a differential. We mentioned that as a differential for infectious laryngotracheitis. So there is there's no substitute in these cases. You can't just look at these animals and say, it's pox, it's ILT. There's no substitute for a good biopsy, autopsy material, or maybe at least take some of that exudate, make a smear of it, and see what you see. So wet pox can be a respiratory issue in poultry, and you want to differentiate that from ILT. Now, the vast majority of pictures that you will see, and probably cases in the world of pox, are on the skin. It's in a lot of different species. It's not a big deal. You get skin lesions. Okay, unfortunately, in a number of species, it is a big deal because this virus will go systemic. Think about smallpox in people. It's a bad disease because it gets into the epithelium of other organs. And there are certain ones that are associated with epithelial lesions. On the epithelium, they're probably about the same. It's proliferative and necrotizing pneumonitis. This is sheeppox, and sheeppox is one of the worst that you get. Sheeppox, camelpox, smallpox in people, rabbit pox to a certain extent, but the lesions aren't as extensive. But the poxviruses that affect small ruminants and camels are bad actors. They cause a high mortality because they're very happy to get into the epithelium of the lung. Here's another case. This one's a little more necrotic, okay? Proliferative with a necrotic center. This one just is colored by hemorrhage. But you get these lesions. It infects the epithelium of the lung and causes the same exact lesion. You can see lesions in the kidney. You can see lesions throughout the gastrointestinal tract. So these are the bad actors of the pox world, and you can see poxviral infections of the lungs, which result in the death of these animals. Usually these sheep or goats have lesions on their skin as well, especially the lesser haired skin of the face and the ears and around the anus and the genitals, but they will have lesions all the way through. They have tremendous catarrhal sinusitis because of the lesions in there as well. So those are the pox viruses, so don't sleep on the pox. Herpes, adeno, and pox are the DNA viruses that cause significant morbidity and mortality in the respiratory system in domestic animals. Okay, we're getting up on an hour, so that's a pretty good length of time, but these are some very important diseases that you need to know about, not because they always kill the animal, but because these viruses leave the animal open for the secondary bacterial infections. Okay, Tomorrow we're going to talk about the RNA virus. This will probably be another hour lecture. I'm looking forward to, there's some really fun viruses in there. So there's some great lesions, so I'm looking forward to that. Make sure that you look at some of the other videotapes, either on the JPC video library or the Foundation's Facebook page or our YouTube channel, which is over 300 hours now of phenomenal pathology lectures. With our new virtual seminar series, we're amassing a tremendous archive of material, and there's some really great stuff. Go back and check out Dr. Del Piero's lecture on infectious viral agents of the respiratory system. He has a little different take than I do, and I think that all information is good information. There are a couple of other things. If you look at the Foundation's Facebook page, from time to time we have posts by Dr. Mbazal Asaf. He is a pathologist who likes viral diseases, and he has recently put up a nice short video, they're about 20 minutes long, on blue tongue, on coronavirus, the COVID-19, and some of the other viral agents that cause respiratory diseases. And you can find that on the Foundation's Facebook page if you search Dr. Asaf. That's ASSAF, and it'll bring up his videos, which are very, very good as well. Okay, hey, thanks so much for spending some time with me. Stay out of the spray. Be safe. We're all going to get through this together. And I'll see you again tomorrow.